So to start, I'd like to welcome everyone to this webinar. My name is Jonathan Leighton. I'm the Executive Director of OPIS. Just a few quick notes. So the webinar is being recorded so that we can post it online afterwards. And I'd like to ask everyone to keep the video and microphone off. So it will just be on for the speakers, but you can use the chat function to ask questions. So the topic of the webinar is the experience of living with rare, extremely painful neurological conditions known as SUNA and SUNCT, which are both short-lasting, unilateral, neuralgia-form headache attacks with somewhat different symptoms. And we'll also be discussing the difficulties of obtaining effective treatment through the medical system, and also a promising avenue for treatment discovered by one of our speakers. So just to be clear, this is not intended to be a technical webinar where we discuss the physiology and the entire range of treatment options. It's meant more as an opportunity for two patients to tell what it's like for them, but also to inform others of treatments that are not part of the current medical repertoire, partly for legal reasons, and that might offer hope. I'd like to extend a big thank you to our guests, Amar Deep, who is in India, and Juan Pablo L'Huillier, who's in Switzerland. And each of them will speak for around 10-15 minutes about their situation. And then afterwards, we'll be answering any questions that any of the other participants have. So again, please submit any questions you have by text. You can send them anytime using the chat function, even while the speakers are speaking, and then we'll get to them at the end. So before I pass on to our speakers, I'd like to just say a few quick words about OPIS and our mission and how I got in contact with Amar and Juan Pablo. So the Organization for the Prevention of Intense Suffering, or OPIS, is a small think and do tank with large ambitions. And we're dedicated to promoting compassionate ethics in governance so that the prevention of intense suffering of all sentient beings, actually, humans and animals, is the top priority of decision-making. And in a way, you can look at this as the implementation of the golden rule, basically that we treat the suffering of others as urgently as if it were our own suffering. Now, intense suffering can include both severe physical pain and also deep emotional suffering. One of our main specific areas of focus is to promote better access for patients to substances, medications that are known to help alleviate severe physical pain. So we've been advocating for access to morphine for people with terminal cancer and other conditions, especially in lower and middle income countries. Morphine is often the only substance that is effective in alleviating severe pain. Although I should add that it doesn't generally help people with neurological conditions like cluster headaches or SUNCT and SUNA. Many governments don't make access to morphine a priority because of excessive fears of opioids, that people will become dependent or that the drugs will end up on the black market. And this leaves millions of people each year in severe pain, even though morphine is cheap and readily available for purchase. So this is one major global public health issue. We're also working on behalf of cluster headache patients. So as some of you know, cluster headaches are one of the most excruciating conditions known to medicine, and they have the nickname suicide headaches. Well, for obvious reasons, that patients can often be driven to suicide in an attempt to escape the horrific pain. And we've been advocating for patients to be able to legally obtain certain psychedelics like psilocybin and also LSD and DMT because they've provided dramatic relief to many patients. So the physiological basis of cluster headaches is still poorly understood, but a better understanding may help to develop better treatments. And in the meantime, patients should have the right to anything that can relieve the pain and prevent attacks from happening. Psilocybin has literally given many patients their lives back. And once again, when governments create obstacles to access through excessive regulations, they're actually exacerbating the problem and causing people to live in that extreme pain unnecessarily. So this brings me to the topic of our webinar today. In late 2020, I received an email from Juan Pablo where he wrote, he wrote the email after discovering our work on behalf of cluster headache patients. And he told me that he had SUNCT, which I was not familiar with at the time. It's much rarer than cluster headaches. He was having over 200 attacks a day and in agony, and he asked for help to treat the condition. And now, obviously we didn't have any magic cure available, but I we tried to provide some support. We've been in contact since then, and he's expressed the desire to tell people about what it's like to live with the condition. He's also had some breakthroughs through experimentation with certain psychedelics, which have not been documented as a treatment for this condition, to the best of my knowledge. And so I hope that this webinar will also help to make his experience more widely known. And then through my membership of a group for patients with SUNCT and SUNA, I came in contact with Amar, who has SUNA, which, as I mentioned, is a related condition. And he's been on his own roller coaster ride seeking medical treatment. And we've been in regular contact as well. Amar also recently asked if we could hold a webinar so that people could learn that his own acts of desperation to end the pain are not a sign of craziness, but simply of extreme suffering. I think people often have trouble understanding or empathizing with what people in extreme pain go through. And this is probably one of the main reasons or one of the main obstacles to developing more compassionate policies. So, Amar, I'm going to pass over to you now and ask you to tell us your story.
Hello, guys. I'm Amar Deep from India. I live in northern part of India in a small city called Patna. I am diagnosed with SUNA like 2 years ago. Previously, I had like headaches since like 10 years. Um, it started with like migraine, and after like 1 year, I went to like different hospital and they admitted me and they said that I have TAG, but they didn't specify what kind of TAG. Later on, they said that I have cluster and it was like very painful clusters, like it's the pain in the eye and it feels like you have to push your eye inside, like putting your arm and like this uh, for like 1 hour or sometimes 2 hour also because the treatment wasn't helping. They didn't added verapamil and they keep giving me naproxen as I remember. So it was very difficult and I was like banging my head to the wall and asking for some relief, but there was naproxen pill wasn't helping. Later on, they said that you need oxygen. They added me on oxygen. And that was helpful. It took around like 20, 30 minutes to work. And I was taking it on high, what they say, high pressure or something. I don't remember. Later on, I started having pain in the face, like from this side to this. It was like shocks in the face. Uh, and it was like very sudden, like for some seconds, sometimes 5, 6 seconds, and these keep repeating, uh, keep on repeating, like stop for like 2, 3 minutes, and again, it was like very excruciating. Sometimes it come in the mouth also, like lower jaw and upper jaw. It was like triggered with cold. If I eat something colder, then it triggered it. If I give you example that how it feels, it's like when you eat anything like ice cream, and it feels like some numb, strong kind of feeling, like numbing feeling or uh, a brain freeze kind of thing. It feels like that. So I was having both cluster and they diagnosed it with TL, and I went for surgery in 2020. They did it. They put some Teflon inside my brain, and the surgery was called NBT. And but after like 2 months, uh, the pain started again, and they did MRI, and they said that the Teflon that they put inside is out of its place, so they did surgery again. But after the surgery, the pain become uh, different kind. It changed the course. it starts feeling like stabs in the head, like something sharp going inside, and then uh, gone for like some second, like 5, 10 seconds. It's in inside and gone, and it's keep on repeating for hours, hours and hours, like 3 hours, 4 hours, like this. And it was like very painful, like very painful. So, and it induces like fear inside me that it will come. And there was like nothing triggered this time, nothing. It just started randomly. Stabs, and the stabs were very painful. And there was no about it. So they diagnosed that it's a SUNA because during those attacks, I had like watering from the eye and from the left eye only, and there was a sweating also during the attacks. So after like 2, 3 hours, I felt like, uh, what can I do? So I like keep banging on the wall and asking my parents that why it's not stopping, and I was crying in pain. They took me to the hospital and they gave me same thing, uh, tramadol and sometimes I don't know the name, those kind of thing, but they aren't helping much because it's a very short lasting and it's keep getting worse and worse. So in the meantime, they did some nerve block also, but nothing. I mean, it was very like 2, 3 days of relief and same thing. Then I started taking dexamethasone, and it was helpful. Like the attacks, if I take like one shot, the attacks were like gone for like 2 days maximum. But the dexamethasone totally changed my body. Like it's a puffiness on the face and uh, some marks on my body, like in the hand. It was like dark blue color patches, and it made my mental health very bad. Like I was craving for food, and 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 I was like very irritated. Like I wanted to fight with somebody and something like that. But yeah, pain was little better. But recently, after that, my neurologist put me on a injection called Emovig. That injection helped me immensely in cluster headache, like a lot. Like it's very less now, but it didn't did anything for Suna. And the pain is like very severe kind, and because it lasts for like some seconds or maximum of 1 minute, you feel like terrorized that it will come again and again, and anything doesn't work. I also had like lidocaine 10%, so I put on the area where it hurts. It mainly hurts here and here sometimes. This area randomly, but it will like goes inside this, inside this. So that lidocaine sometimes numb the pain, but not always. So it's like I don't have any abortive for this. They put me on gabapentin, oxcarbazepine, lamotrigine, duloxetine. And now I am on 2700 mg gabapentin, 1800 mg oxcarbazepine. And these drugs, in the meantime, like eroded I mean, my memory got hit. Uh, I start sleeping a lot, and I was feeling a lot of confusion doing my work, so I took leave because I wasn't able to work, and it's the mind become very cloudy, like confused, and sometimes I forget the names, but the picture is inside my head that okay, yeah, this one, and the pain was getting bad and bad. They also did gone block. The blocks last for like 2, 3 days, and then again same thing. Besides SUNA, I also have different kinds of disorder, but this one is the most painful. I mean, if I rate 1 to 10, it's it start with 8 and goes up to 10 plus. So I tried to do suicide also. I tried 2 times because uh, I can't tolerate for hours because at some point of time you feel like that it's over, like you can't tolerate it more. So yeah, it's uh, very painful, and there is not much treatment in India that can do. They tried every kind of medication on me that it blocks. The only thing that is left is DBS. I talked to a neurologist, but he said that that's not a good idea. So yeah, I'm stuck with this. I didn't try any psychedelics or anything. So on that side, that is left to do. My cluster is controlled with MOIC, but this one is like it doesn't listen to anything. It's a it's a very painful thing, and no about it, nothing. It start very randomly. I don't have any trigger for this. It's a very random thing for me. So yeah, that's it. Yeah.
Okay, Amar, thanks for telling us your story. I'm sure there'll be some questions afterwards about some of the details, but maybe we'll move to Juan Pablo first, so he can tell us his story.
Yeah, of course. Well, let's say everything started out of the blue in the end of July in 2020. I was with this huge stress with this COVID thing, and I lost all my clients, and I was losing the bar that I was working with, the guys, and it was like really extreme. I was in extreme stress, and then out of the blue, I was working in France, and I started having this huge pain in my jaws, where I was feeling this like electricity going through here, and then everything. I couldn't understand the pain, in fact. So when I came back to Switzerland, I went to the dentist because I thought it was something in the teeth, like pain and teeth pain. I wasn't understanding what was happening. So when the dentist told me I didn't have any problem with that, it was like, okay, I have to see another doctor. I went to see the maxillofacial doctors, and they didn't know what to do more than give me like huge tons of oxynorm, that is an opioid. And then I went to see the neurologist in the SUNCT here in Switzerland, and there was like a clash. They were understanding the pain, but they were like scared of what I was trying to explain them, because it was like, oh no, we have like this huge case here. And then, well, we started with these treatments with, well, of course, Dimotrigine. They start to see if I was going better with that or not. Then they realized exactly that the diagnostic was SUNCT. And I was having this extreme rush of pains all day. It was almost continuously. And opioids didn't do nothing. I was having a lot of other treatments that were coming, like experiments that they were doing, the doctors, that they were working at all. And then, I don't know, I had to be hospitalized for a month and a half. And in the hospitalization, they experimented with me with tons of things that I don't even remember, because I lost the memory about it. And I had like 4 months where I was not even conscious of what was happening. I was just being there, And then at the end of this hospitalization, they made me this gamma ray operation, which made everything, if it was bad, then everything went worse. And well, talking with the doctors, trying to see another stuff, we made perfusions of ketamine, which worked really well the first time, and then it didn't work at all. We started having also Emgality, which brought me much more problems. And then the thing that is happening like right now, after all these months of testing this and that and all, is that I started having not also pain in this stabbing pain, as it, Amar explained it. I had started having pain here in the back of my neck, and slowly it went through all the body. You know, my hands are trembling, and I'm always like in huge amount of pain from head to toes, you know. And the condition have been proven to be getting worse and worse. So there's a degeneration that it's been declared, and exactly we don't know now which is the new way of to diagnose this, because it's hard to say what is happening, because it started with SUNCT, but now it's like something else. Having also the SUNCT symptoms, you know, having also the pain in the head and the eye that you want to and take out of your eye, you know. I have had so many problems with it, and I had so many questions to the doctors. Nobody can answer nothing. So in one moment, I couldn't feel like I was hopeless. And so I tried to commit suicide at the end of 2021. And when I tried to commit suicide, 1 week after, I went to the center where they gave me ayahuasca. Sorry, I forgot a little detail before. In 2020, also, when I was diagnosed, I saw on internet that LSD can work. So I tried LSD, and actually it worked. I was pain-free for 1 week. But the problem is that I found it in the black market. And then it was really hard for me to find it again. So it was like, hell, I don't know what to do. So well, again, doctors and stuff. And now we're in 2021 at the end. And so let's say it's the day before Christmas. And I was given ayahuasca, which has DMT inside. And when I was under the substance of ayahuasca, of course, you have these psychedelic things going on and stuff, which are not that dangerous. And dramatically afterwards, like 4 to 5 hours after that, I could walk again. I was pain-free from all the body, and before I couldn't take the stairs, now I was running up and down the stairs. So it was like really a huge change and like a lifesaver, because if it wasn't of this miraculous plant, I am surely I could not take this anymore. This is you can't live with this. It's inhuman. This is not like living with extreme pain. This is more than pain. So that's kind of the story, you know. And what I want you to understand, that is the important thing, is that these kind of extreme issues with these neuropathologies, with this extreme pain everywhere, it can't be treated with doctors, because they don't know what to do. They're going to give you tons and tons of medications, and you are going to have all the side effects of it. And while you're in the side effects, you don't know what you're doing, you're not what is happening, you don't remember nothing, and you're still in pain. So it doesn't work. And I can't say that it works. I can't say to you guys, yeah, you know, a neurologist here told me that this could work. No, it doesn't. it may relieve a little bit the pain, but it doesn't work. So ayahuasca, DMT have proven me to be pain-free for almost 3 weeks. And now I'm taking regularly every 3 weeks, so I can be relieved and try to, how you can say, maintain myself in this world. Because like this condition, it's, as I was saying, it's impossible to live. And people that are in extreme cases, like severe cases of this, I can understand that they want to take their lives, because this is not a life to live. Now my problem is another, it's degenerating to other things. But for all those who have only one only the SUNCT symptoms, go and ask anywhere you can to have this kind of treatment. There's not going to be given by the doctors. You have to go, that's not only the black market, but you have to search, because you're going to find. If I found here in Switzerland, you can find anywhere. And understand one thing, being away from pain through more than 24 hours, it's something that you are not used to when you're just living in pain. So it's also scary, because you don't want that to come again, but it starts and starts. So this is not a cure, it's just a treatment. So that's my story.
Okay, thanks very much, Juan Pablo, for sharing your story with us. Sure, we'll start having some questions from participants. And as I mentioned early on, we have Brian McGeeney, Dr. Brian McGeeney on the webinar as well, and he's, as many of you know, he's a neurologist based in Boston who's had a lot of experience treating people with cluster headaches, but he's also has a couple of SUNCT patients. And
that's right. Can you folks hear me?
Yes.
Wonderful. Thanks for your stories. I can't help but be reminded that there is a Swiss physician who some years ago petitioned the Swiss government and got official permission to take LSD for his cluster headache, and did so successfully. Possibly the only example in the world of a government-sanctioned psychedelic use for cluster. And I haven't heard much from him in recent times. Young guy, but I think it's it's an unbelievable story. Are you familiar?
With me?
Yeah.
Yeah, of course I am familiar with the story, but again, I know another neurologist here in Zurich who she was going to treat me with LSD. The only problem is that here in Switzerland, the private medical system is way too expensive.
Okay.
The insurances doesn't want to pay for treatments that are not regular, you know. So you can be treated with LSD professionally, but it costs like $2,000. One dose.
But you know, that's one step better than most countries.
Of course, yes.
Yes, it's abominably expensive, but it's a start.
Yeah.
There's a question here from Matt, and this is a question that sort of comes up as well for cluster headaches, and that's whether sub-threshold, or let's say sub-hallucinogenic doses of LSD or ayahuasca can also work for SUNCT or for SUNA. And then another question is, why do psychedelics seem to help with these extreme suffering cases? Which is more of a physiological question. I guess we don't really have enough examples of their use for SUNA or SUNCT, but Juan Pablo, I think you've told me that when you were using LSD, the dosing was actually in the sub-hallucinogenic range. Is that right?
Sorry, I couldn't understand well the question.
So the question was whether sub-hallucinogenic doses are effective. And I seem to remember you telling me that for when you were using LSD for a week, you were basically microdosing or using sub-hallucinogenic doses, and that was effective. Is that true?
Well, I was using, first of all, I was using like a normal doses, not how do you say, microdoses. I wasn't microdosing at the beginning. Then I started microdosing, and it couldn't help enough. It couldn't work in a long term, but it was working extremely well with one dose, normal dose, where you are hallucinating and where you're hallucinating, where you are kind of high. And with that was working better. Then when I was microdosing, it wasn't doing too much, and that was giving me more like a little relief, but it was coming and coming and coming and coming again, like a snowball, you know. So yeah,
I mean, it's conceivable that it's not the actual psychedelic effect that's necessary for the treatment. I mean, that would be consistent.
Of course not.
Yeah.
Of course not. Of course not. Well, I have more experience with DMT, and I've been reading a lot about it, and I've been like really trying to see all the literature that I can with it, and it's proven, widely proven, or it's merely proven, sorry, that DMT has a huge regenerates the neural system. And by that, I think it's because the DMT works, but it's not because you don't have to take something to get the hallucination, and the hallucination is going to work. It's not because you're going to have like a psychological treatment with the drug, you know. It is not that. Well, that's a side effect, in fact. The real effect is how it works in the body, physically.
Can I make a point?
Please.
That's the issue of whether one needs to take a dose that would have a lot of clinical effects or not. That's a question often wondered by people. Point I want to make is that it is possible to take a higher dose, a good dose, and then take a medication like a benzodiazepine to prevent the psychedelic experience. And so somebody who wants to take a sizable dose but doesn't want the psychedelic effect, this is all anecdotal now. With the benzodiazepine, that's diazepam, that's the Valium family, that's the clonazepam. That sort of family will tend to prevent the psychedelic experience at the price of being drowsy. So that's one way of getting a good dose and avoiding the psychedelic experience. That's a point I wanted to make. And also that this microdosing is, of course, very, very new. So there's an enormous amount of anecdotal experience using the more standard dosing and anecdotal experience with benefit. So one big difference, and there are a couple, between the standard dosing and the microdosing is we don't have as much experience. So our degree of confidence and usefulness is very much unclear, I would say, with the microdosing compared to the standard. That's what I wanted to say.
Amar, I mean, I guess in India it's probably more difficult to obtain these substances. And anyways, we don't need to say anything on a public call, but yeah, obviously.
Speak generally, not personally. I mean, generally, if one was to, or have you come across people who've easily acquired? Amar?
Amar, we need you to unmute.
Yeah.
Yeah. So, I mean, the question was, do you know about the possibilities of obtaining substances like psilocybin or LSD in India? Have you heard of people being able to obtain it?
Yes, people obtain those like magic mushrooms, but the thing is, you don't know if it's like original or not. So most of people say sell those. What's the word to say that? not a real one. And there is high chance of like getting caught. So yeah, that's the issue. I mean, you can buy it, but mostly it will be not the real one. That's the issue. And for other substances like LSD or that kind of thing, I don't know about it, that where to get it.
Not wanting to change the subject, but just so you're aware, and if you wanted to ask, I have one patient with chronic SUNCT who I would intermittently give a nasal ketamine, which would stop the attacks for a period of time. Now that's stopping the attacks, so without them going to sleep. There's a dose, it's an anesthetic, but at a dose not big enough to put them to sleep, but the attacks would stop. So the attacks stop before you get drowsy enough to go to sleep. Now the attacks stop, that may be only half an hour or an hour, but it enables the patient to eat and to do what they really need to do. It's not a great option, but it is an option to reliably stop the attacks temporarily.
Okay.
So does anyone else have any of the other people who have joined the webinar? Are there any other questions you'd like to ask any of the speakers? Maybe just a general question to both Amar and Juan Pablo. I mean, do you have any particular, let's say, expectations from the medical system or from your governments that will make it easier for people with your conditions?
You want to answer before me, Amar, or I start? Well, I'm going to start.
Yeah.
So here in Switzerland, as Dr. Brian McGeeney said, there is an advanced medical system about that, so we can have LSD treatments, but advancing in psilocybin or advancing in DMT, I think it's kind of difficult, but at the same time, it's a country who tolerates the use of DMT, because ayahuasca is also recognized as a religious ritual, and when it's with a religious ritual, it's legal. It's not absolutely legal. It's tolerated by the law. So that's why there are these kind of shamans here, or you have this also the thing that would Elena, she works in this enterprise that they give you ayahuasca so you can have the experience of it, and it's also tolerated, but at the same time extremely expensive. So the problem is not that the government is tolerating or not, is the insurances to be tolerating this. Because if you don't have the quantity of money to pay this kind of treatments, you're done. So it's not the government itself the problem, it's more the insurances that they don't want you to do something that is not regular, because it's not normal and it's not given by a chief of medicine or a neurological area. So the main problem is they are not going to help you, and that makes the treatment impossible. It's because, well, Switzerland is expensive.
Yeah. So I mean, yeah, psilocybin mushrooms are probably a lot less expensive to obtain, and another point that one person has mentioned in the chat is that of course mushrooms can also be grown individually. I mean, they can be grown at home, which is done. So in the US, for example, even in places where it's not legal to buy them, you can still purchase grow kits, and presumably that would be an option. I don't know if it's actually legal to. It's probably not technically legal to grow them in India, but there is that option. I mean, which is actually very low cost. And I don't know, Juan Pablo, if you've used. It doesn't sound like you've used psilocybin mushrooms, but it's conceivable that they would have a similar kind of effect that you've found with ayahuasca and with LSD.
Well, I tested with mushrooms too for the pain, and I had kind of the same effect that I had with LSD in the way that it lasted a week of pain-free, but it wasn't. But then after I tried ayahuasca, and it went further, you know, and that was more easy for me to find because I could find in a place that I can rely on, not in the black market. And yes, as you said before, well, I can grow it, but I don't know how to, and I didn't thought of doing it, but I can.
Yeah.
Yeah.
I mean,
it's not illegal here in Switzerland to grow up mushrooms.
Yeah. I mean, the whole situation is obviously unfortunate. I mean, patients shouldn't have to grow their own medicine. I mean, people should be able to get effective medication through the medical system at known dosage. But in the absence of that, you know, people have to take matters into their own hands. And it seems like mushrooms, or at least you don't need any raw substances. You basically just grow them. And that's probably one of the reasons why it's also been so popular as a treatment for cluster headaches, even though LSD seems to be similarly effective. Another comment here from Claire, who says, I will just read her message. I take lamotrigine and oxcarbazepine, but although both keep the pain under control, I have typical side effects, and I've tried many others. Do you know of any other medicines that are in development? I'm under the National Neurology Hospital in London, and I don't know how to grow mushrooms. I don't know if, Brian, you want to answer that question, because that's a little bit more about other treatment options, which I'm not aware of.
I'm sorry. So the patient is on lamotrigine and oxcarbazepine,
Exactly.
which sounds like it reduces the intensity of the attacks.
Yeah.
They may still be getting the attacks, but just less intense. Because remember, there are different outcomes one can get: number of attacks, length of attacks, intensity of attacks, responsivity to other meds. So they're different. And what's the question?
Well, the question is if there are any other medicines that are in development that you're aware of.
Ooh, you know, I honestly don't. Nothing that I can think of. That, I mean, there are pipeline. There's pipeline stuff, but nothing that I'm aware of that may fit easily in here, except the BOL, the brominated LSD.
Mm-hmm.
So that, of course, there's so few people with SUNCT that there won't be a clinical trial on that. But once, at least in the United States, once a treatment is indicated for some disease, a physician can use their discretion to give it to other people.
Yeah.
Now, if it's expensive, insurance may squawk and not pay, but at least there's some access. But the brominated, since we're talking about these are for those who are unfamiliar, the LSD molecule is added and takes away the psychedelic effect, essentially. And that also means you dial up the dose. So the dosing of LSD for clinical effect is microdoses, whereas it's milligrams. Much more with BOL you can give, and that's what was given in a short exploratory study of 5 subjects over 10 years ago now, showing the benefit in cluster and a prolonged benefit. So that's the best chance at a manufactured product with closely related to psychedelics. And if people are worried about the term LSD, but ergotamines are very close, and DHE is very close to LSD as well. So
there's a comment here from Anna Williams, who mentioned that Praxis was, I think, developing something, but they haven't pursued SUNCT and SUNA. They're looking at a sodium channel blocker,
Yes.
and they seem to have backed off.
I think they may have been looking at trigeminal neuralgia. It's a total, which is another severe facial pain, but dramatically different. And I think Amar knows all about it because it's a nerve problem. So it's actually not a brain problem.
Yeah.
SUNCT, SUNA cluster are brain disorders. Trigeminal neuralgia is a nerve disorder, very different. I think in some ways harder to treat.
There's another question that
Sorry.
Yeah.
I have a big question to Brian. Brian, sorry. So you're telling that because here in Switzerland they just told me that I have a neurological disorder, not a brain disorder. I haven't never been told that it's a brain disorder.
Well, by saying neurological, that's what they mean.
Okay, of course, yes, but they told me more the nerves, you know.
You see, well, the nervous system is composed of the brain, spinal cord, and all the nerves that come out. And we often refer to in the business peripheral nervous system for nerves in your arms, legs, back, belly, that sort of thing, coming out of your spinal cord. And then, so fundamentally, when somebody has a neurologic problem, we are thinking, is this a brain problem, or peripheral nerve problem, spinal cord problem? But these are unquestionably brain problems. There's no question. No one disputes that.
Okay, perfect. Because the thing is that because now that my problem is going through the nerves in all my body, they've been telling me I'm having my nerves that are sick, but it's not.
Well, that's like saying in the old days, migraine was said to be a blood vessel disorder. But migraine is also a brain disorder, but it affects blood vessels. And in SUNCT SUNA, often one gets the tearing or nasal blockage on that side, and these are peripheral manifestations of the central brain disorder. Yes, there are nerve abnormalities, but it's all secondary. You can work backwards. Whereas in trigeminal neuralgia, the problem is in the nerve, not the brain.
Okay. Thank you.
I agree with Brian McGeeney. In trigeminal neuralgia, you have
You sound dropped out, Amar.
like shocks. Hello. Like here,
We didn't hear you, Amar.
like shocks.
Sorry.
Yeah, can you hear me now? Yeah. Okay. So, you get very sharp pain, but for like some seconds, and it's gone. In the teeth also, it feels same. But in SUNA, but in TN, you don't get tearing or anything. It's just hair to hair. And if you touch your face also, like suddenly and air is blowing, you get triggered. But in SUNT or SUNA, there is no trigger. It starts randomly here, like stabbing, like something very sharp going inside the head, and you start sweating here, and water is coming from the eye. So both are very different. That if you get MVD, it will get cured, or the TN will be like 90% gone. But here in SUNA, I don't know. I mean, didn't find any about it, but yeah, lidocaine 10% sometimes work. It numbs the area, so you feel less pain. So yeah, both are very different. Yeah.
Brian, there was a question from somebody asking if Adderall and or Botox can help. Somebody apparently with SUNCT has found they work. Have you heard anything like that?
Well, I'm very familiar with the actions of botulinum toxin, otherwise known as Botox. And it's the standard use of it in migraine, injecting different parts of the face, in fact, in the muscles. I don't see, it doesn't make any sense to me that would be in any way helpful. The only, the caveat, the one area that's a little more interesting is injecting it directly into a ganglion, sphenopalatine ganglion. I think if you go to clinicaltrials.gov, there is was it a Norwegian trial on injecting into the ganglion? And that, in some ways, at least conceptually, makes a bit more sense. But to inject in the face or in the forehead Botox for this, I think, is a complete nonsense. It won't treat the pain, in my opinion. That's my opinion. And there's certainly no... You may find cases where people purporting to say there's some benefit, but I don't believe it's causative. So I'm very... I don't think that's worth pursuing. Sorry, the Botox, what was the first one? The first question?
Adderall.
Oh, yeah. It's funny you say that. So let me broaden the question to stimulants, the amphetamine-based stimulants. A good while ago, I had a patient with cluster, and he got into a bit of misadventure and was using a lot of methamphetamine. When he was using, he wasn't getting the cluster, which is kind of interesting. Now, we know anecdotally that Ritalin, methamphetamine, can help migraine as a side effect, and I have used it for that purpose to treat refractory migraine. So certainly methamphetamine won't irritate these anyway. It remains to be seen if it has any role. Adderall is a related stimulant, not exactly methamphetamine, and it's unclear, but I'm not that worried that it would irritate unless the patient feels it does. I'm not that... So there may be a role for stimulants, unclear. Again, my experience is anecdotal based on small numbers of patients. I'm not that enthusiastic, but it might just. And I'm in this setting, we're really dependent on you guys, patients, giving your experiences, which would then help us formulate hypotheses about what might be useful and what isn't. That's a long-winded answer.
By the way, on the practical side, I wanted to get back to one of the questions where Claire, you said you don't know how to grow mushrooms. Just for anyone who is actually interested in growing psilocybin-containing mushrooms, the information is available on the website of Clusterbusters, which is one of the main organizations in support of cluster headache patients. And so you can find it on their website. And I can also, if anyone has any specific questions, they can contact me directly, and I can provide the information. So just so you know. There's also a question about lifestyle and nutrition or nutritional supplements. So again, there's a lot more known about cluster headaches than about SUNCT and SUNA. And I think it's fair to say that different people have different experiences. That I mean, at least for cluster headaches, I know that they can be people of different kinds of triggers and stressful situations, for example. And on the other hand, something that has been found to work is a high dose vitamin D regime, and the details of that are available on the OPIS website under cluster headaches, and also on the Clusterbusters website. I don't know if anyone has any insight on anything that has an effect on SUNCT and SUNA. So I think that might be a bit of an open question. Juan Pablo, Amar, any sense of that from your own experiences?
Well, I was given vitamin D, a lot of, and while taking it, it didn't do nothing. So I don't have a good experience with that. Of course, I think that if you eat really well and you have all the vitamins that you need, and if you are not drinking and you are having a normal life and you're just sleeping well, maybe that could help a little bit.
Yeah.
But it's not nothing that is gonna be like a miraculous thing, you know.
But
After
how much?
that,
But how much did you take? I mean, the proposed use of D in cluster is enormous.
Well, it was like I don't remember exactly. That was given by
Do you remember
this
what your level
yeah,
was? You see, this is not treating a deficiency. It's using it as a treatment.
exactly. It was just like a treatment. So it was for like I don't know how to
Well,
say
let
it.
me tell you that the protocol would frighten a typical physician, but the concern, but when you go into it further, it's not frightening. Your D level rises more than your primary care has ever seen. They get into a tizzy, but that by itself does not cause toxicity. D causes toxicity by rising calcium, and calcium can be checked. It's typically normal. It's actually very difficult to get toxic on D. It's easy to have a high D level. It's difficult to be toxic from it, have to have symptoms related to toxicity, as long as it gets checked occasionally. I mean, people were taking on the current protocol, I think, as much as 50,000 units a day for a few days, even a week, and then down to a smaller amount, but still a day. And with SUNCT SUNA, you know, of course, quickly whether something's going to be helpful or not.
Yeah, the thing is that I was with this doctor is called Livia Granata from Zurich. She gave me a lot of vitamin D. She told me to take I don't remember exactly the quantity now, but she told me to take this kind of quantity what I took for a month. And we were speaking by email if there were changes or not. And then there was the discussion of taking LSD with her because she saw that the vitamin D wasn't working with me. But again, there was also limiotrogen in the moment. There was Oscar Basepin. Oh, no, there was Oscar Basepin, sorry, and there was pregabalin at the same time.
You know, one thing, I know it's difficult. It's one of the most difficult disorders to describe to other people. And one of the challenges you guys have is it's all about the details, the dosing, the amount, the time, the responsiveness, and that's a lot. So see, just like I'm pushing you for, it's a bit unfair of me, but I'm pushing you for dosing, but it all depends. These numbers are everything in this game. And I think that's the only way we can practice as a physician. We have to push for exactly how much did you take, roughly speaking, for how long, how did you feel? So it behooves, so it forces patients to be a transcriptionist of their own life.
There don't seem to be any other questions, so I think we'll probably bring the webinar to a close in a minute. But there is a comment from Ainsley Course from Clusterbusters, and she expresses something which I entirely agree with, and that's that we're very grateful to Amar and Juan Pablo for sharing your journeys, your experience, and sharing intimate details with a public audience, and which is not an easy thing to do. But as Ainsley says, it's the only way to raise awareness of conditions like this, and for people to know what it's actually like to experience it. Because it's only when people understand what it's like that they will take it seriously and the doctors will be able to find more effective treatments, and the governments will expand the range of legal options to treat these conditions. So so again, thanks so much to the two of you for sharing your stories with us. And also Brian McGeeney, thanks for jumping in on short notice like this and providing us with a broader perspective and your own experience with these conditions. And again, if anyone has any additional questions, feel free to contact me directly. And if you want to pass on, or I can pass on any questions to the other speakers. Yeah.
Just want to say one thing, just to add at the end, that what we are doing here is to exactly create awareness to one of the most complicated pathologies ever existed. So the thing that you who came to see this webinar, I hope you learned something, and at the same time, if you are suffering from this or not, or you know somebody that's suffering from it, you can find a lot of information. And as Jonathan was saying, contact him, because I am in contact with him regularly and we are discovering things together. So let's these things advance, and please, DMT really works, and I'm always going to defend that.
Amar?
Yeah, I want to say that Indian government should legalize some of the opiates. In India, only tramadol is available, and rest are they banned all of these, and they also give morphine to very less amount of patients. Recently, I got morphine because I was having attack in the neurologist office. So they gave me morphine and it worked. Else, I want to say that mostly the people who are near us, like friends and all, they said that, okay, it's migraine, because it's very difficult to tell them that what I am suffering from, right? Anything that is head, the pain in head is not migraine. Because we are suffering from it and we know how much it's deliberating and painful. So people very complicated. So it's very difficult to tell them what is happening. So yeah, first point is that. Second one is like on the patient. It should be like from it should be not like in India. I don't know what happened in the rest of the world. In India, it's like they throw a bunch of medication on you, like everything from antipsychotic, anti-seizure drugs, pain drugs, and everything. They just throw on you, even steroids. And what happens that we as a patient suffer. Our memory get affected, our lifestyle get affected, our work is affected. So everything is affected. And on the top of it, you have pain. So it's become very hard. And they ask you questions like, did this thing work or not? So it's very difficult when you are a bunch of medication to say that what's working and what is not working. So yeah, I think it's a very difficult disease. So yeah, people should be empathetic. They don't judge you, saying that it's a migraine or it's just a simple headache. It's not. So yeah, that's my point. Yeah.
Okay. Well, thanks again to both of you. And again, I'll just mention, if anyone has any questions that didn't get answered, or if any questions that come up, please contact me and I'll either answer them myself or pass on any information you request, or forward your questions to Juan Pablo or Amar. So thanks again to everybody for joining, and I wish you all a good rest of the day. Bye-bye.
Thanks, Jonathan. Bye.
Thank you, guys.